I'm a doctor and I just got my wisdom teeth removed. Here they are in the bag. Oh, gross. So I'm gonna show you my journey and exactly what you need to know to recover well after wisdom teeth and surgery in general. So first things first, do you need to have your wisdom teeth removed? And the answer is it depends. There is no scientific reason to get them removed if they're not causing problems and they're not projected to cause problems in the future. For me, they were developing cavities and only getting worse, and also I wanted to get my teeth straightened out, so they wanted to have my wisdom teeth removed for that. Okay, first, the preparation. You should know it takes 1 to 2 weeks for you to recover after the wisdom teeth surgery. Now, I was back after day 3, but that's not totally realistic and you should not expect it. But here's how I recovered. And by the way, I wrote a book with a couple of my colleagues. Check the description below. It basically has everything that you need to recover after surgery. It's completely free. Check the description after this video. So number 1, your journey starts with finding the right person to do your surgery. And my advice is don't just go to a dentist, but go to an oral surgeon who specializes in this. And I know dentists are gonna come at me and be like, oh, well, I can do it too. But guess what? My channel, my opinion, and the more you do of something in healthcare, the better you get at it. So find somebody who specializes in oral surgery and wisdom teeth removal. Now, number 2, you have to optimize your body before surgery. What does that mean? Even the smallest surgical procedures place an enormous stress on your body, comparable to running a marathon. You would not run a marathon without a proper preparation and nutrition, right? So ideally, a day or 2 before, even a couple days, you want to start eating really clean, avoid any processed foods. Generally, meals with complex carbohydrate can do a trick. You essentially want to carb load for your surgery and put your body in the repair mode. So whole wheat pasta can do the trick. Include healthy proteins in your meals. Salmon can do the trick because it has also omega-3s, which are helpful in healing. Obviously, put a little bit of greens in there too. You want the antioxidants. And if you're gonna use sauces, use the natural ones that have not a lot of processed chemicals in them. All the chemicals in the processed foods really can drastically slow down your healing. Now, I also took Heal Fast, which is a supplement for surgical recovery. It's a bunch of vitamins that help you heal well after surgery. And full disclosure, I created the supplement over a decade ago for my own mom to heal after surgery. So it's, vitamins, minerals, amino acids, probiotics, pretty much everything you need to heal. You start that 5 days before surgery and you continue it for 10 days after surgery. And it has all the ingredients to help with bruising, swelling, and pain, all the things that you're worried about with wisdom teeth. Now 3, and this is really important, you actually want to cut out all the other supplements, including your daily multivitamin, which is going to have vitamin E, which can actually increase bleeding during the surgery. Also, take a look at this list right here. These are all the things that you should avoid at least 7 days before surgery. Day of procedure. This is me. I elected to get IV sedation. As you can see, I'm getting ready. I'm getting the IV placed and the anesthesia will come through the IV for me. There are other options like inhaled anesthesia, nitrous, or laughing gas, or even you can stay awake for the whole thing, which honestly, I don't recommend. Now, if you're getting anesthesia, you'll have to have fasted the night before for at least 8 hours, nothing to eat. You can have clear liquids up until 2 hours before surgery. Now, what people don't tell you is that those 2 hours before surgery, you actually can have a coffee. If I don't have a coffee, terrible headaches. But make sure in this coffee, there's absolutely no milk because they will cancel your surgery if there's any fattening foods or milk. This anesthesia thing is wild. Yeah, anesthesia is crazy. Afterwards, I was awake, doing things on video, and I remember none of it. It's totally insane. I actually had my own patients that had anesthesia that day went home and planned an entire wedding, and the next day had no idea any of it happened. Wild. I mean, I wrote text messages, I wrote emails. I have emails to catch up on. And I had no idea later I wrote them. Totally wild. Like, bonkers. So that day, don't plan on doing anything like that. Do not sign any legal documents. Do not write any crazy emails. Do not quit your job. You will also need a ride home. They won't let you leave unless you have somebody else driving you. You can't drive or operate machinery for 24 hours. All right, so now you're getting home. So the first thing to do probably is take some pain meds. As the anesthesia, the numbness is wearing off, you're gonna have some pain. I personally immediately after took Heal Fast post-op. It has a lot of anti-pain, swelling, and bruising agents. Really, for the first couple of days, you're not eating very well, so the nutrition in Heal Fast, I think, really helped me recover. And there's a lot of scientific data that in the first 7 to 10 days, a lot of these nutritional elements really speed up healing. But what you do need to do is you need to plan ahead, because for the first few days, you're mostly eating soft foods. So you still want to have a nice, solid diet that's going to help you heal. So get things like yogurt, cottage cheese, applesauce, even Jell-O. But again, try to avoid the processed foods if you can. Consider investing in or borrowing your friend's blender. A blender will allow you to pack in nutritious foods and make sure you heal well after surgery without having to chew, which you're not gonna be able to chew for the first day or 2 or 3. And again, if it wasn't obvious already, now is not the time to go on a diet. You actually want to increase your calories. That's gonna put your body into repair mode. And probably the most important thing is hydration. Hydration, hydration. Honestly, lots of water, that's your friend. Avoid anything fizzy, and in a little bit we'll go into why. So before I go any further, I want to stress the importance of following your surgeon's post-op instructions. Whatever they say should trump anything that I say, because they know you the best and can give you the best advice. But here's this, surprise to no one, pain after surgery is normal. You're gonna be tender, it's gonna be a little bit painful, but each progressive day, the pain should be getting better. Your pain should be controlled. Aim for something like a 3 out of 10, and obviously you're gonna have pain medications to help you with it. Now, here are concerning things to call your surgeon about. Pain that is getting worse each day. Pain that can't be controlled with the pain medications you are given. Bad odor in the mouth. Fever. Increased bleeding after first few hours after surgery. Now, by the way, for the first few hours, you might have a lot of oozing, and that combined with saliva can really make it seem like it's a lot. It's okay, hang in there, it's gonna get better. Now, here's the most important part of recovery and the most important part of the video. After the surgery, there will be a blood clot that will form over where the tooth is removed. And that blood clot is the most important thing when it comes to your recovery. That blood clot covers the tooth and protects the nerves and the bone underneath. And that's what is going to stop your pain and allow you to heal. Now, if that blood clot falls out early or dissolves early, that can set you back for weeks. That is called a dry socket. And everything we're gonna talk about next is there to prevent that from happening. So again, follow your surgeon's advice, but protect the clot. Typically, this means bite on gauze for the first few hours. Do not suck on anything. No straws, these can dislodge the clot and set you back for weeks. No sucking on candy, and no sucking on a cigarette. Now, tobacco is particularly bad because the nicotine can constrict those small blood vessels that allow you to heal. Constricting those blood vessels mean no blood going to the site, which means no healing. Cut out all nicotine for at least a couple of days after surgery. No spitting either, that can dislodge the clot. Do not rinse your mouth in the first day, that can dislodge the clot too. Now, brushing your teeth usually can be good, but you really want to stay away from the site of surgery. A clean mouth is a mouth that will heal better. Now, sneezing and coughing, you should also avoid these if possible. If you have allergies, definitely let your dentist know before. They might prescribe you something to suppress your sneezing and coughing. Because again, that can dislodge that clot and cause a dry socket. By the way, dry sockets are excruciatingly painful and again, can set you back for weeks of healing. Also, do not exercise in the first several days. That can increase your blood pressure and can dislodge that clot. That was honestly so hard for me because I was like, oh, I just want to move. But no, just relax, sit back, watch some TV, close your eyes, really rest and recover and allow your body to heal. Also, when you're laying down, avoid laying flat. When you're laying flat, All the blood flow can go into your head. Elevate your head with a couple of pillows. It allows better blood drainage from your head. No hot foods or beverages. Those can also irritate the tissue that's healing. Stay away from alcohol. That can delay healing in the first week. Ice packs are fantastic for the first day. You want to do 15 minutes on, 15 minutes off. It's really going to decrease the swelling. Most doctors do want you to stay away from the ice packs after 24 hours. All right, now speaking of day 2, swelling. Swelling usually gets worse around day 2 or 3. Before it starts to get better. So just expect that. Pain is usually the worst day 1, and with each day, it should be getting a little bit better. So if the pain's getting worse, you really should think about calling your doctor. A lot of doctors will recommend salt rinses starting on day 2 and usually continuing for a week. Now, the most important thing with salt rinses, none of this. You do not want to use your cheeks, because that can dislodge that clot that is so critical to healing. And I'm sorry to repeat myself over and over again, but it's important. So how do you rinse? You put the fluid in your mouth and you go like this. You gently rock back and forth. I know, it looks hilarious, but it works. So really you want to do this 3 to 4 times a day. And what salt rinses do is they actually clean your mouth, they kill the bacteria, and they can reduce the swelling too. So you might even feel better after doing them. Otherwise, my biggest and the most important advice, follow your post-op instructions from your surgeon. I cannot stress this enough. Your surgeon will know your particular case the best. So overall, I healed up pretty well. It wasn't too bad. And this is me about a week after. As you see, not a lot of swelling. Obviously, I'm talking okay to do the video. I'm still having some soreness, some tenderness, but it's really manageable. And my surgeon told me I'm healing amazing. So if you follow the things that I'm telling you, hopefully you can have a great recovery too. Don't worry too much. Just try to relax as much as possible. You'll get through it. It's gonna be fine. And if you have time, check the description below. I'm gonna put the ebook that I wrote with my colleagues for surgical recovery. It's totally free. Totally free, and it has all the advice for surgical recovery, not just wisdom teeth, but for all surgeries. Consider using Heal Fast supplement. Obviously, I'm biased because I created it, but I thought it helped me. You can check it out on Amazon. It's got a couple of thousand reviews at this point of people that also think it helped them. But otherwise, good luck. I hope this was helpful. And if you like this video and you want more, please like and subscribe for the algorithm. It helps me a lot as a content creator. And I hope to see you again soon. Bye.